Magadang Arapo. Good day. I congratulate all the organizations participating in this National Summit for collaborating to celebrate 35 years of work to cultivate the growth of hospice and palliative care in this great country. It's an honor to contribute to this event, which I understand includes some courses for advocates, providers, and leaders and stakeholders, meeting and fellowship, and a master's training workshop to share the progress made over the last 35 years. That's wonderful. And I'm going to tell you a tiny bit about IAHPC and emphasize our common ancestry, our genealogy, which goes back much more than 35 years, to celebrate, for those of you who might not know it, the founder of hospice and palliative care in the Philippines, whose passion was clinical education, which you're all going to be doing now. So many of you probably knew Dr. Magno, but I'm going to talk a bit about her. The IAHPC is a global membership organization in official relations with the World Health Organization and in consultative status with the UN Economic and Social Council. We have more than 1,000 members in many different countries, including 32 in the Philippines, which we see when we click on the interactive map on our website. All those red dots include countries where we have members, and you can click on those dots and find out who the members are in those countries. Members can take online courses on advocacy, pain and symptom management for generalists as well as specialists, and we just completed a course in palliative care for neurological conditions, and we'll have some more courses next year, including for caregivers. New members can watch the recordings of all our courses if they can't join live, and I specialize in advocating for improved safe availability of palliative care opioids in the framework of rational drug laws and raising awareness about palliative care in faith communities. So if you'd like any lectures on that, please let me know. IAHPC members can apply to join delegations to our meetings with the World Health Organization, especially the Regional Committee, which meets in Manila in October, the World Health Assembly in Geneva, and the Commission on Narcotic Drugs in Vienna. And for the last few years, you have sent delegations to the Western Pacific meetings in Manila to represent the IAHPC and spread the word among regional member states in the area, so we thank you for that. And I would like, as I said, to talk very quickly about the ways we're a family, because not only was I born in the Philippines a long time ago, the inspiration for IAHPC, our great-grandmother, Dr. Josefina Magno, was born in 1920 in San Fernando, Pampanga. She's with us today in spirit and is so proud of all of us. Dr. Josefina Magno's journey with hospice began when she trained in oncology at Georgetown University in the U.S. and was inspired by St. Christopher's in London and opened a hospice in Virginia. She saw the suffering of patients dying without palliative care on her oncology ward, and organized the International Hospice Institute to train physicians in 1984, and then the Academy of Hospice Physicians, AHP in 1988, which then evolved into the American Academy of Hospice and Palliative Medicine's AAHPM, which is still growing strong, in 1993. So that was the American branch, but then the International Hospice Institute evolved into what's now the International Association for Hospice and Palliative Care, IAHPC, which is our organization. So Josefina is a great-grandmother for all of us. She moved back to the Philippines in 1995 to see how the hospice concept of care could be introduced into her home country, where people have limited resources, limited health insurance, and no government-funded hospice care. She helped to develop several models of hospice care, including for the indigent and home care. A devout Catholic, she also emphasized the importance of spiritual care, and she herself died in Manila in 2003. So Dr. Derek Doyle, who's one of our emeritus board members, says that Dr. Magno saw more than 100,000 hospice and palliative care services established in more than 100 countries. So she was a true missionary, and we stand on the shoulders of giantesses today. But before I finish, I want to quickly warn you of some wolves in sheep's clothing that many of you may have encountered already. But first, the private sector is taking over hospices in the US because it's very lucrative. And the movement that Dr. Magno has helped to found in the 20th century has now become a profit-oriented industry that no longer has the welfare of patients at heart. So she would be turning in her grave. There's a lot of literature coming out on this now. Don't let this happen in our great country, the Philippines, because hedge funds see fat profits in owning hospices for aging populations. Encourage your government to procure generic medications such as oral morphine if you can, and don't let the pharmaceutical industry hoodwink your drug regulators to allow the distribution of expensive patented medicines that are also attractive on the black market. This is an advocacy priority for us, so if you want to have me back to give lectures on it, I can. And last but not least, in your overwhelmingly Catholic country, this may not be a problem, but the euthanasia and assisted dying movement is very well funded and is making inroads into public policy in many countries, including Catholic countries such as Colombia and Ireland and Ecuador, leading to the disinvestment in palliative care and palliative care training, something to be very careful of. This must not be allowed to happen, and partnerships with the faith communities are all key to stopping that public policy for developing. So these are just a few of the sources I used to do some research into Josefina. And maramang salamat, and have a great conference. Thank you very much for inviting me. I really appreciate it.